Hello everyone. Today we will discuss one of the important high-yield topic for NEET PG pharmacology, and that is the new drug treatment for sickle cell anemia. So before starting with the new drug for the sickle cell anemia, let us first understand what happens in sickle cell anemia. So sickle cell anemia, it occurs because of the development of HbS. When HbS is deoxygenated, it will polymerize and that will result in development of the sickling of RBC. The sickling of this RBC that will result in hemolysis, and this hemolysis will ultimately result in vaso-occlusion and vaso-occlusive crisis. Now, these newer drugs target the different parts of this process. So, let us discuss the newer drugs in detail. So the first drug is crizanlizumab. Crizanlizumab, it blocks the P-selectin, and this P-selectin is responsible for addition of the sickled RBC and leukocytes to endothelium. So crizanlizumab, it blocks the P-selectin and prevents the addition of the sickling RBC and leukocytes to endothelium, and that will ultimately result in decreased chances of the vaso-occlusive crisis. So this is the monoclonal antibody which is useful in the treatment of the sickle cell anemia. Next drug is L-glutamine. This drug decreases the oxidative stress in the RBC, and that is how it will decrease vaso-occlusive crisis. Voxelotor, it increases HbS affinity for oxygen, and it prevents HbS polymerization and RBC sickling, and that is how it will decrease the vaso-occlusive crisis. So remember, voxelotor, it increases HbS affinity for oxygen. Hydroxyurea, this is the traditional drug therapy, and that increases the fetal hemoglobin, that is HbF, and that will decrease the sickling of the RBC and decreases the vaso-occlusive crisis. So these are the drugs for the sickle cell anemia. Now let us discuss few MCQs. A 22-year-old woman with the sickle cell disease continues to experience recurrent painful vaso-occlusive crisis despite hydroxyurea therapy. She started on monoclonal antibody that blocks P-selectin. Which drug has this mechanism? Voxelotor, crizanlizumab, talazoparib, L-glutamine. The drug which blocks the monoclonal antibody and which blocks the P-selectin, that is crizanlizumab. So crizanlizumab is the correct answer. A patient with the sickle cell disease has persistent hemolytic anemia despite standard therapy. A drug is prescribed that binds hemoglobin S, increases its oxygen affinity, and inhibits HbS polymerization. Which drug is most likely responsible? Hydroxyurea, crizanlizumab, voxelotor, and talazoparib. So correct answer here is a voxelotor that will increase the affinity with the oxygen. A 10-year-old child with the sickle cell disease is prescribed an oral therapy that decreases the oxidative stress within erythrocytes and thereby decreases vaso-occlusive episodes. Which drug was prescribed? L-glutamine, hydroxyurea, crizanlizumab, olaparib. So here the correct answer is L-glutamine that will decrease the oxidative stress. So this was about the newer drug therapy for the sickle cell anemia. If you like this video, then subscribe to my channel and follow for more such pharmacology related videos. Thank you.